So growing up, every kid makes mistakes, big and small, and while a lot of small mistakes can be overlooked and sometimes under an hour, a lot of big mistakes can follow a teen well throughout their lifetime. Teen pregnancy is one of those big mistakes that sometimes occurs, no matter how effective teens may be at using safe sex practices. Teen pregnancy is a very prevalent occurrence today and can have adverse effects on the mother and the child being born, both short and long term. So before we begin, giving a little background, Dmitry Skolov et al. In 2017 states that nearly 16 million girls between the ages of 15 and 19 years old and another 1 million girls under the age of 15 give birth every year, making teenage pregnancy very prevalent in today's world. And with this, teen pregnancy while teen pregnancy has an equal chance of affecting all teens, it is more likely to occur in teens who come from a lower socioeconomical class. So with this, what are some of the short-term effects that teen pregnancy can have? So physically, a teen mother is less likely to healthily and fully sustain a child simply because their bodies are underdeveloped. So adding to this, Kabir Ahmad in 2004 states that babies born to girls in their teens have a 50% higher risk of dying than babies born to mothers in their 20s. And some of these complications that teenage mothers can have during their pregnancy include babies being born prematurely and babies being born with lower birth weights. These complications can greatly affect a neonatal baby such that they can have a harder time recovering from these complications. But apart from a teenage mother being underdeveloped, a lot of times, teenage parents can bring a lot of complications on themselves. So a lot of times for teen moms especially, it might be hard for them to talk about their pregnancy and therefore not get the guidance or the direction that they need to seek prenatal health care as far as getting them and their baby in for routine checkups, and also getting a lot of preventative measures such as prenatal vitamins and other things like that. And a lot of times they might not be able to financially support that or be able to afford that kind of health care because they don't have the financial backing that they would need to do that. So while the short-term effects are pretty damaging, the long-term effects can sometimes be worse. So a lot of times mothers can't finish school because they have to support both them and their child. And as before, especially if the financial backing isn't there, they have to do a lot of it on their own, and therefore they drop out of school to support them and their baby, which can have pretty damaging effects. So Erica Jelenko et al. In 2017 states that women with teenage pregnancy had a higher risk of overall mortality versus controls, and are more likely to die as a result of suicide and alcohol-related causes, as well as many other causes. And Jelenko explained this as those women having a lower educational level. And on the kids' side, growing up, not only having access to the necessary needs, especially if they grow up in poverty, and coming from a mother who might have been thrown into motherhood, they might not have received the proper guidance, and so this also is shown to have a lot of detrimental effects as well. And according to Greg Pilarski et al. In 2006, due to low maternal wealth, boys born to teen mothers had an elevated risk of drug use, violence, unemployment, and early parenthood. And similarly, girls had an elevated likelihood of early parenthood. And so it's kind of a never-ending cycle or loop for teen parents who have kids who ultimately, most of the time, especially if they grow up in poverty and kind of up in the cycle of poverty and teen pregnancy and violence and gang relations and things like that. So very unfortunate. But as you can see, teen pregnancy is very prevalent today, and not only can affect the mother and the baby, but it can also have short and long-term effects.